Okay, welcome to a quick but essential deep dive. You've shared some revision notes with us.
Hmm.
And our mission today is really just to slice through them, pull out the absolute core knowledge you need on Mittelschmerz.
Yeah, this is a really common one, actually, something that, comes up. So getting these key points locked down is definitely helpful for a revision.
Absolutely. Let's get into it. So, the name itself, Mittelschmerz.
German.
Right. Yeah, exactly. German for middle pain.
Okay.
And, well, the name pretty much nails the main idea.
Right.
We're talking about abdominal pain that happens, right in the middle of the menstrual cycle.
During ovulation.
Specifically during ovulation, yeah.
Mm.
The notes suggest it's something some women experience.
Mm.
And the potential causes listed are things like follicular fluid leaking out.
Well,
Or maybe even the ovary stretching a bit.
so middle pain, ovulation-related, but what's the sort of deeper mechanism, the etiology?
Well, interestingly, the revision notes point out the exact cause isn't, like, fully pinned down.
But it's definitely tied to ovulation. The thinking is when that follicle ruptures to release the egg,
Yeah.
it also releases some fluid, maybe a tiny bit of blood.
And how does that actually cause the pain sensation?
Right, so that fluid and blood, they can irritate the lining nearby, the peritoneum.
Ah, okay, like a local irritation.
Exactly. Both mechanical and chemical irritation leading to some localized inflammation. And that's what you feel as pain.
Got it. So who's more likely to experience this? Are there specific risk factors mentioned?
Yes, the notes list a few key ones. Basically, having regular cycles where you are ovulating is number one.
Makes sense.
Having experienced it before, so a past history. And potentially hormonal imbalances might play a part too.
Okay. Now, pelvic pain. You always have to think broader, don't you? What are the crucial differentials, the things you absolutely must rule out?
This is probably the most important clinical point here.
Right.
When someone comes in with lower abdominal or pelvic pain mid-cycle, you can't just assume Mittelschmerz. You've got to think, could it be endometriosis?
Ovarian cysts, pelvic inflammatory disease, PID,
Mm-hmm.
Even things like UTIs or, GI issues,
Mm-hmm.
appendicitis, maybe.
Yeah, absolutely. Understanding Mittelschmerz helps put it in context then. A benign thing among potentially serious ones.
Exactly that. It helps you recognize when it might just be this straightforward cause.
Okay. How common is it, actually? Do we know?
The notes say the prevalence isn't, like, super well documented globally,
Right.
but they do indicate it affects a, considerable number of women who ovulate regularly, especially noted in the UK context. It's
Yeah.
definitely not rare.
Okay. So let's paint the picture. What does it typically feel like for the patient, the clinical presentation?
Usually described as unilateral lower abdominal pain. So
Cool.
one side,
One side, okay.
predictably mid-cycle, obviously.
Yeah.
Duration varies. Could be just a few hours, could stretch to maybe a couple of days.
And the onset, is it gradual or?
Often sudden, yeah.
Wow.
Starting typically in one iliac fossa, so
Mhm.
lower abdomen side area.
Though it can sometimes feel a bit more generalized in the pelvis later. Pain level?
Hmm.
Usually not severe, but it can vary.
Okay.
And it's self-limiting. That's key. Goes away on its own, generally within about 24 hours.
And it can switch sides.
Yeah, fascinating detail, right? It can switch month to month, depending on which ovary decided to ovulate that cycle.
Any other signs?
The notes mention light vaginal bleeding or spotting is possible sometimes too.
Okay. So given that typical picture, what investigations are usually needed
Well, the main point here is that the diagnosis is usually clinical.
based on the story?
Exactly. Based on the history, that classic timing, the character of the pain, and a physical exam,
Which is usually normal.
typically normal, yeah,
Uh.
including the pelvic exam, there isn't a specific blood test or scan that says, yes, this is Mittelschmerz.
So when would you investigate further?
You'd investigate if the pain is really severe, if it keeps coming back in a way that's worrying, or if there are other symptoms.
Red flags.
Yeah, red flags, basically, that suggest it might be one of those differentials we listed. It's about ruling out other causes.
Right. Okay, so how do you manage it if it is just Mittelschmerz?
Management is really just focused on relieving the symptoms. It's usually simple stuff.
Right.
Over-the-counter pain meds like paracetamol or ibuprofen. Applying heat, like a heat pad. Rest.
Okay.
For cases where it's really severe or impacting quality of life significantly, the notes mention hormonal contraceptives might be an option as they suppress ovulation.
Ah, right. Stop the trigger.
Exactly. Or other medications. But honestly, the main message is It's generally benign, not harmful, and simple analgesia usually works well.
Which leads nicely into the prognosis. Sounds pretty good.
Yeah, it's considered a benign condition, self-limited, the pain goes away by itself, no long-term complications from the Mittelschmerz itself.
So complications aren't really a feature of Mittelschmerz per se?
Correct. Complications aren't really associated with it directly. If someone has severe pain or other concerning symptoms alongside it, that's the trigger for investigating those other potential conditions. So really, for you listening, understanding these features, the timing, the one-sidedness, the self-limiting nature, it's valuable because it helps you distinguish this pretty common, generally harmless cause of pelvic pain from other things that absolutely do need looking into further. It gives you that confidence to recognize the pattern.
It really highlights that clinical assessment and knowing those differentials inside out. And, here's a final thought to chew on. Even though this is clearly a common experience for many women, described for ages, the notes point out that the exact step-by-step biological mechanism causing the pain, it's still not completely pinned down.
Yeah, a little bit of physiological mystery still there.
Bit of a mystery around this middle pain. So that was a focused run through your revision notes on Mittelschmerz.
Covered the key areas.
Yeah, definition, causes, differentials, management, all the essentials. For more depth, obviously, go back to your core sources.
Yeah.
And if you were prepping for exams, you might find resources like PassTheMSRA.com useful.
And FreeMSRA.com for free questions, too. Knowing the common stuff really well is honestly often the most powerful clinical knowledge.
Couldn't agree more. Thanks for joining us on this deep dive.